Just had our midterm CPI, as you guys know, right? It's kind of like where we evaluate myself, and then my CI or my instructor evaluates me on what's going on, how I'm doing professionally, how I'm doing with my skills and all that. And I've been getting quite the experience at this new place. A lot of manual therapy skills, so really learning how to assess and feel with my hands. I really took for granted of how much I can really understand the patient with just the power of the touch. So learning a lot about that. If you want to learn more information about that, please comment or message me about it. I can definitely make a video or address your question. And just learning more about these different types of high complexity patients. The other day I had a patient who was coming in for back pain, and she has COPD. So okay, so I'm asking her about all these back pain questions, and then all of a sudden she's like really getting like short of breath, and I'm like, what the hell? So I say, hey, let's just sit down, use my calm voice, and I just lay her down, tell her to breathe, practice diaphragmatic breathing. 2 times as long, exhale out as you go in, and basically practicing all my COPD skills, checking out the patient, observation, affect, skin color, breathing, how is she breathing, you know, all those things you learn in cardiopulm. Who would have thought that I would have been using that in an outpatient setting? I think you would see it more in an inpatient, but outpatient, I don't know. And then another patient, oh my gosh. So this patient was, she comes in, she has a wig, super bubbly, super funny lady. She's a lot older. She had a facelift, and she like had all this reconstruction in her face. She's like, you know what? I'm getting old, screw it. I'm gonna be a cougar. And so that's the type of personality she has. So she has neck pain, right? And then so my CI had her before, and she came back in for another evaluation for something else. And so I lay her down, and then she's like, oh, let me take my wig off. It'll probably be easier. So she takes it off and then puts it in her crotch area. And then my CI goes, hey, you can put your wig anywhere but there. That just looks wrong. And she has this wig that's like silver, and it's like she just puts it in her crotch. It's all like a bush. I just lost it at that point. I finished my day today, and I would like to share the lesson that I learned. Now, my CI kind of said something to me that I thought that was interesting. He said, look, your profession is based on research, right? And I want to emphasize this. Do not be a lazy PT. Meaning, I want you to test as much as you can. And even if they're false positives, still try, because you can always retest them later. Because you go to school to learn these special things. And let's say like you have a shoulder problem, and your doctor or your orthopedic only did one special test for every single diagnosis that's involved with the shoulder. How convinced would you be that when he says, look, you had this, you're like, well, you only did one test on me, and other tests that you did on me were also positive, so how can you be for sure? And to me, that kind of spoke volumes, because he's right. Like, if my mission in life, if my mission in my profession is to serve others to the highest degree possible, to the most highest quality of care, then I should be doing everything that I possibly can with the best accuracy to make an educated guess on knowing that, look, I've done this, and because of this, it is way likely that you have this, and I can say that with high confidence. To me, that spoke a lot, because it helped kind of stretch me, you know, to be better with these patients and to just serve them better. And this is a form of doing so. And you can do that with customer service, you can do that with all these other things. But if your diagnostic tools are that much better, then that means down the road you're going to be able to serve them at a much more efficient and better quality of just service. So that's all I had to share today. And since he said that, now I'm gonna go review my stuff and basically try to understand those special tests and nail them and try to hold on to them as much as possible, so that when I am working as a actual PT, that I will do them and do them well to make sure that we are getting on the right path.
Wait, and I'm acting like I'm not being recorded right now, so I'm trying to, you know, yeah, I gotta try on my shoe.
Come on, dude, do it for the vlog. Tell them.
What's up?
How's your experience?
We going that way.
We're vlogging
My
now.
experience is great. My CI, Michelle Rabosi, DPT, PT, OCS.
AKA my old CI.
Okay, AKA his old CI.
AKA the best CI I will ever have ever.
She taught me how to cut the ropes and chop wood, carry water,
Pound stones,
pound stones.
climb mountains, chase lions.
Chase
Look
lions.
up, praise Jesus.
We're out here in Benihana's for PJ's birthday. He's big 2'4". Went to 24-hour fitness this morning to work out as well. Maybe got a Kobe jersey, I don't know. But you know, he's lacing up, getting ready for the big game.
Lacing up because we about to eat. We about to go buck wild, dude.
Level up, level up, level up, level up, level up.
What's up, guys? So I am driving, and don't text and drive or vlog and drive, but I just finished work and I just had to get this off my chest before I forget anything. But I got an ass whooping this week. Damn. Long story short, just kind of brushing up on nerve roots and things like that, because every time my CI asked me what nerve roots are those, what are the dermatomal patterns for this and this and this, I kind of was not confident and didn't really know 100%. And so, I have a lot of homework to do. She goes, oh, so this one patient says, hey, I kind of have some symptoms right here in my neck, and then it kind of goes into my face a little bit. And then my CI was like, so what kind of source tissue would that be? It's like, nerve. She goes, what kind of nerve and where's it from? Cervical? It could be maybe in the neck, but how about in the face? Where it's coming out in the face? And I'm over here in my head. To touch. Trigeminal. She's like, very good. What branch? Damn! I don't know. Oh man, so I got a lot of work to do there. I had another patient today, cross straight leg raise, positive. And so, all right, so maybe we got some signs of a herniated disc, right? And then put on prone elbows. She felt a lot better. Awesome. Come out, colleague says, hey, so if you raise the leg and it actually decreases symptoms, what's that indicative of? Damn, I don't know. So much homework this week. Not to touch, but because I remember something. One, I'm not taking the exact blame for it, but I know the difference between when the patient came in and the patient left. I don't know what the hell she might have done on her own, but I know we did increase some of the reps and dosage of home exercise program and just exercise in the clinic in general. And she came back more flared up. She was 4 weeks post mastectomy, so they took out part of her meniscus, and she was great. She was strong, she was going. So I said, all right, me being the personal trainer and all, I'm like, hey, well, let's increase some of your reps. We didn't increase the weights or anything, but we brought the reps up. And next thing we know, she comes back flared up. Now, I don't know if it's me or if it's her or anything like that. Like, I can't really say for sure, but I'm the type of person that always says, hey, I'm not going to blame you for something. I'm always going to think about myself and what did I do. how can I reevaluate what I'm doing and change that, because I'm always about learning and doing better on myself and not blaming others for it, right? And that, I think honestly that's more applied to life in general. But anyway, I digress. So learning lesson, 4 weeks post-op, able to weight bear and everything, so she's pretty good. But you also have to respect tissue tolerance and respect the fact that, you know, she might not have been able to actually handle all that kind of stuff. So learning lesson, just I'm learning that, kind of bridging that gap between, yeah, Therex is great and you can progress people in that sense, but also recognizing that these patients are very sensitive and weak, and they're not normal general fitness people who are like, all right, you just need to be pushed because you're scared to lift heavier weight kind of thing. And I'm learning every single damn day when I'm in there, and my brain is constantly just on, and that might be a good thing. But at the same time, I'm super tired, especially because I have this wedding coming up, even though I'm only doing 20% of the work. But, you know, it's still kind of stressful for me, right? Anyway, this week is done. We got 4 more weeks to go. I have a lot to learn. And if you guys want to learn more about something or want me to talk more about something, please let me know, because I'm always willing to share. So have a great one, you guys. Just please, I thank you again for your support, and please continue to give me some feedback on what's going on, because like I said earlier, it's not about looking outward, it's looking inward, and that's biblical. Bye.